This video is about pediatric neurological examination. We have to start with the history. In history, it's important as with adults, carefully and accurate neurological history is the most important part. Discussing onset of symptoms in chronological order is often helpful. Other characteristics is frequency, duration, statics, progressing or improving, it acute, subacute or chronic. Systematic revision and read history.
Prior to the examination, a medical history must be drawn up. The medical history of a child differs from that of an adult in the following ways.
The medical history of a child is often a third-party history, which means that the information is provided by his parents or by someone else caring for him.
In the history of a child, we are interested in developments during pregnancy and birth. We also want to know if the child's stages of development correspond to his or her age.
What is also of interest to us here is the child's weight, not only his present weight, but also his weight development and diet.
We also want to know what vaccinations a child has had, what childhood diseases, and if he has been in close contact with people with infectious diseases.
The next part is about a general physical, when we have to the measure on height, weight, blood pressure, and head circumference. General appearance includes the morphology, the skin exam, location of the hair, quality of scalp hair, eyebrows and nails, exam of the midline of the back and neck for cyclical dimples, comparison of thumbnail size under convexity, presence of unusual body odor which is present in some inborn errors of metabolism, hepatosplenomegaly. In the researching for anomalies,
now I'm going to show some special procedures that we use to evaluate a child Jeffrey's age. Jeffrey's 9 years old. He falls into the school age group. And in a child at Jeffrey's age, you would actually treat him as a young adult. It would start with a head-to-toe examination, just like you would any other adult. It's important at Jeffrey's age, to remember that there still may be some modesty issues, so you want to respect that at all times. It's very important to involve the child at this stage. You want them to know that the examination, physical examination, is something not to fear, and it can be a very, very positive interaction between the child and the clinician. So what I would normally do in approaching Jeffrey might get from a child, they're going to be a little hesitant at first. And so what you want to do is try to get them to warm up to you. Jeffrey?
The complete video is in the Percy.com. Upon physical examination in the skull, we have to looking for microcephaly, craniosynostosis, or premature closure of the coronary sutures, prominence of the skull veins, increasing the intercranial pressure, flattening of the occiput, causing hypotonia. In cranial nerves, the exploration, we have to start with the olfactory. Next, we have to talk about the optic nerve. We have to searching for oculomotors, as we can see in the video. The baby is looking for the object, and we can see how is the cranial nerve. That's it for egg part, vestibular cochlear nerve. And continue with the other cranial nerve. In motor and cerebral. In motor, we observing the child posture and simple manuals such as retrieving a ball or running outside. The examination room can check motor integrity.
Watch his hip. Open up first, pull yourself up, good suction,
back down. You go back down, he can resist that, he starts good head control, puts it all the way in front of his trunk, and less time easy. Very good.
And that is the motor part. About cerebral and sensory, how a child reaches for and manipulates toys can check for coordination and the rumble test. In sensory, pinprick like touch, position and vibration sense. Object discrimination with tech for higher cortical function can be done using coins, paper clips or rubber bands. In reflexes, Jogger demonstrated the preservation of cranial nerve number 5, Bisek is the number cervical 5 to 6, triceps cervical 6 to 8, brachyradial is number cervical 5 to 6, patellar is number lumbar from 2 to 4, ankle is sacral from 1 to 2. Babinski signs and pyramid tract diffusion is which one is positive or is one in the presence. Babinski signs is a dorsiflexion of the grade 2 and fanning of the 2 can be normal up to 1 year of age, so symmetric is the important feature to look at below 1 year, maybe seen after a seizure.
Look at the position of the hand. The hand should be able to open and close, but most of the time it isn't closed to open, not a tight close thing. It can elicit a grasp reflex by him putting the hand right there in the thumb and look at the grasp. We can open the hand by stroking the side of the hand and just sending the grasp reflex by then putting the hand right there and having a grasp reflex. So the grasp reflex, and we get the baby, really quite there. So he's almost pulling himself up as the grasp reflex, and we're going to hold on that thing. As far as just putting pressure here to all the foot, close your finger on the flexion, if you guys.
Thank you.